Hello, so I'm in a bit of pain at the moment and it's given me an idea for a video. I'll just share my story with you quickly. So not last night, night before, I went to the gym, done this CrossFit class. Haven't done any strength training for a couple of years and I've just gone in there like a man possessed. I've gone in there, whacked on loads of weight, started deadlifting very quickly, very cold, and my form went and pulled my back muscle. Okay, yesterday I couldn't really walk because I was in a lot of pain. Today, not so much pain, can walk about a little bit, got a lot more movement. So that's led me to this diagram behind, and I just want to share with you how you can work out the difference between something which is structural and something which is mind-body related. And of course, you know, if you're not sure about anything, go and see a doctor first, always got to advise that. So anyway, so if we think about my story, trigger, what was going on was deadlifting, form went, pulled the muscle, got pain. What's happened with the time? Yeah, okay, you know what, I'm recovering pretty quickly, yeah, so every day I'm getting better, I'm having less pain. So because of that, because my pain's decreasing, because I'm recovering in, I would say, less than a month, I'd go in the structural route. So you've got your rise, your rest, ice, compression, the ventilation, that kind of mentality. Rehabilitation, you know, like your stretches, you might want to see a physio or something, and then you end up functioning pain-free body, yeah? That's the goal. But what about if my trigger was something like tying my shoelace or reaching for a can of baked beans? Or just basically anything which your body's always done, you know, that your body's already kind of adapted to, then you get your pain. And it's lasting for about over a month, over 6 weeks, and the pain's pretty inconsistent. You have your good days, you have your bad days. If that were the case, I'd be definitely going down the mind body TMS route. Then what I'd be doing, I'd be thinking emotionally and psychologically, especially going back to the trigger, what was going on around the time of that. So I'd be thinking, what was going on in my life, you know, what was I pissed off about, was there any big changes going on? You might need some support with that, that's okay, there's lots of people out there, and then you end up at the goal, functioning pain-free body. So that's kind of it really. Where you're going to figure out the difference is here, you know. Is the trigger justifiable for the amount of pain you're in for as long as you've been in it for? So that's a biggie. You really need to be looking at your triggers. Is it kind of inconsistent, fluctuates? Okay, if that's a yes. If it's lasted over 6 weeks, say, you know, I'd go this route. If you're having like a gradual decrease of pain, you're recovering fairly quickly. You know, it takes a bit of time, but you know, if it's in the kind of the first few weeks you're seeing good recovery, I'd be thinking, okay, you know what, I'll pull the muscle, I'll strain the ligament, you know, whatever, and I'll be going down this route. Hope it helps. There you go. Cheers. Bye.